What's up, YouTube? It is your girl, Big Stephanie Key, and we are back with another freaking video, ho. I gotta start cussing, but y'all, it's been a little minute or whatever, but I am back. You hear my fan in the background? Excuse it. I be getting hot and a little bothered sometimes. No, I'm just laying. No, I'm not. But all right, so before I get into what this video is, make sure y'all like this video. Make sure y'all comment on this video. And if you ain't subscribed to our channel, go ahead and do that shit. And share this video. Let me stop playing, because this is like a very serious topic. It's Endometriosis Awareness Month, and this is a chronic illness. How I figured out what endometriosis was. So about around the age of 14, I was having like terrible period cramps, and I always thought it was, oh, because you're a girl, you have to deal with this type of shit. You know what I'm saying? So I thought that was normal. And then like when I got into college and I graduated college and got into those older years, I was in and out of the ER multiple times. Them tell me they can't really do nothing about it but prescribe me something for pain. And now that me going into the medical field, now I understand why they really couldn't do nothing. I can't tell you how many times I've been to the hospital for these endometriosis like symptoms. The symptoms include nausea, vomiting, dizziness, brain fog, paresthesia, which is numbness. So paresthesia of the limbs, your fingers, arms, legs, and especially in the legs, because I got my handy dandy pitch right here. So this is a model of, we'll get into that in a minute. Paresthesia in the legs, irritability, anxiety, depression, terrible cramps, debilitation. Like some days my period is okay, and then like other days it's like I'm vomiting over the toilet. My GI tract is off. I'm in excruciating pain. It feels like somebody is stabbing me with a knife in my ovaries and vagina. I know that sounds a little bit graphic, but we keep it real over here. Excuse me saying it's just, like the list literally goes on. So yeah, that's kind of like the symptoms of endometriosis, and I may have missed some because it is different for everybody, okay? So boom. Like I said, how I found out about what it was, I was having those symptoms and I looked them up. And they say you may have endometriosis. And when I started going to the OB, you know, if y'all know what a pelvic exam is, you know that's not really fun. So when I first tried to do one, I just didn't get it done because inside of, come on, you know that thing tight, baby. But nah, yeah, it didn't work. So she did a trans abdominal ultrasound, and she's like, we can't see anything. I don't see any cysts, any enlargement, any fibroids, but it sounds like you're showing symptoms of endometriosis. And also another symptom, infertility. A good amount of women are able to have kids regularly, but it's still another good amount that are not able to reproduce, and that's when they refer to things such as IVF. I know this video is all over the place, but you know I love my medical, so I get to going everywhere. Okay, so that OB kind of told me, hey, you know, we can get you in for surgery, blah blah. Never contacted me. And now I have a new OB. She did a trans abdominal ultrasound. Goes over the stomach, kind of like, well, actually, you know, like when you get an ultrasound on your stomach, they take that thing and that's what they do. They go on, like, say you got your vagina right here, right? They go over this part right here where your reproductive parts are. said she didn't see nothing, this and that, trying to recommend birth control, which I told her I didn't want. And she was like, okay, well, you're going to continue to have this pain. I'm like, all right, cool. I kind of just going to let it go and keep suffering. But I'm like, nah, this shit got to stop. So I sent her a nice lengthy message. I will post here somewhere. And I was just basically telling her, like, this shit is not normal. Like, what I'm going through is not normal. Like, while, like I tell in the message, while I trust your expertise, I know my body better than anything. This is not normal. I'm asking other girls, other women, do y'all throw up on y'all period? Do y'all be, like, not able to move on y'all period? And they be like, no. And I'll be like, ah! It was just me. Fuck. Like, that is not cool. So, like, endometriosis has affected me in many ways. When it comes to working out on my period, it's really hard. As y'all know, I box. I am learning how to box. Some days I go in when I'm off my period and I'm killing it. Like, I'm moving fast. And then other days, I'm moving real sluggish, you know. And, like, my trainer is, like, he's a man. So it's kind of hard for me to explain to a man what's going on, why I'm moving slow, this and that, blah, blah. Versus when I had a female trainer, she kind of understood. Like, I remember this one day I just got really sick. And she was like, you going to have to go home. Like, I get what you're going through. You're going to have to go home. So it's different explaining that to a woman rather than a man. And no shade to him. But even women, some women have never heard of this disease. So I am here to bring awareness in the most funniest, serious way possible. And I say funniest and fun because I try to make this a light topic, because this topic is heartbreaking. Like, I sometimes sit in my bed and I just boohoo crying, screaming to the top of my lungs because it hurts so bad, right? All right. So back to the numbness in the legs. I'm going to get into that. I'm going to go over the anatomy. So this is a picture I drew of endometriosis, right? So I got the parts labeled out. These little cauliflower looking things here are your ovaries. These are the fallopian tubes right here. And you got all of this right here is your uterus. That's where babies sit, okay? And that's why their stomach be so big, because, like, the uterus is stretched out, right? Now, this opening right here is the cervix. This is the thing that dilates to 10 centimeters after the baby is born, right? Well, while the baby is born, you know, it starts expanding. So you can pass a baby through. This is your vajayjay, your vagina, okay? Now, every month, us women, we shed our uterine lining, this right here. The lining of the uterus right here. And that's called the endometrium. We shed that out, right? So, make sure I'm not missing nothing. We shed that out, like I said. But with endometriosis, you shed that out. Some women also have irregular periods. Thank God my period is not irregular. It comes on time every time. But I can spot, sometimes I spot, and then sometimes I bleed, and then it stops when my period comes. So that could be irregular, but I won't call it too irregular compared to other ladies. So anyways, you shed your uterine lining. But with endometriosis, like I said, you still shed your uterine lining, but that endometrium that you're supposed to shed, like, you also have spots outside of your female anatomy that grow. And sometimes people have stomach issues because sometimes this endometrium, this bad endometrium-like tissue, can stick your appendix. Y'all, you don't need your appendix. I'm sure y'all know that, but it will stick your appendix to, you know, other parts of your body, and you just don't need that. You don't even need your appendix. But anyways, this stuff can spread. Like, it can spread. Like, sometimes when it's on your bladder, they won't touch it because they don't want to puncture nothing, so they'll just leave it there. Sometimes when it's on your bowels, they won't touch it. The gyno may just leave it there because, like, you don't want to, like, imagine somebody go and accidentally cut your stomach. You're probably going to bleed out. Probably going to have a GI bleed. All that blood is going to lead to sepsis. Boom. your whole freaking head will be off. Anyways, but yeah, this stuff can spread up into your thoracic cavity. That's why women also have a hard time breathing sometimes. And very rarely it can travel to your eyes. Very rarely. I don't know anyone going through that, blah, blah, blah. But yeah, anyways, they tried to recommend me birth control. And I just feel like, why I need birth control? I'm not doing nothing that's causing me to give birth right now. You know, I'm a little nasty little thing, but yeah, but yeah. So I am just here to raise awareness, help you guys advocate as a fellow nursing student and a person who does want to basically like help deliver babies. I want to deliver babies and all that stuff. I feel like I need to be up to date on the female anatomy and the male anatomy too, because y'all help us create babies. I'm not gonna discredit y'all, but like this is what's going on. Now, I made this video to say this disease usually goes undiagnosed for like 10 to 15 years because people think it's normal, but it's not. And like I said, my symptoms start at 14. I'm 24. And y'all, another symptom, blood clots. Y'all, not to be TMI, but the way these blood clots, me personally, if you don't want to hear about it, you can leave. I get it. It's kind of nasty. The blood clots, I would be passing like, you know how they say quarter size is kind of big. Mine would be like that, and like I could feel it coming out. And like, mind you, you're not really supposed to clot during the last days of your period. I clot through all my days, and it feels nasty. You would think I miscarried the way the clots be so big sometimes. And this disease has also led me to become anemic. If you ever hear me saying I'm dizzy, my ferritin is low, right? Ferritin is the iron stores in your body. You can have enough iron in your body, but have low iron stores. Don't let anyone tell you different. I also had to advocate for myself there, and that is when I got diagnosed with iron deficiency anemia, which is very common in young menstruating women, right? I remember my ferritin was at like a 6. I can't remember the normal ferritin ranges, but it's in the hundreds. Why is your ferritin a 6? I remember I thought I was going to die. My ferritin was so low because I had been bleeding so heavily during my periods. Doctor asked me how many pads I'm going through a day. I might say like 4 or 5. Because me personally, I use pads. And I just don't want to sit in there all day. So I changed them. But it'd be a lot of blood in it. And also, I don't personally approve of tampons because I feel like if something is coming out of you, let it come out. Don't plug it. And then tampons get lost. And then, you know, all that kind of stuff, right? But yeah, this is kind of a video of my journey. Today is Friday. I really want to go out to the club, but I think I'm going to stay my ass home and prepare for this surgery I got coming Monday. Yes, I advocated for myself. And my doctor is going to be my surgeon. Beautiful black woman. Yes. Like, and if I say something about my OB in this video, it's in no way, shape, or form to defame her or nothing like that. Because, like, she's very polite, very awesome. But also, don't let these providers play in your face. And I don't feel like she was playing in my face. But I feel like she didn't know I knew all of my options. Which was not only birth control, but a diagnostic laparoscopy. I say laparoscopy, but a diagnostic laparoscopy. But yeah, she's a good doctor. So with this numbness in the legs, I'm everywhere. Okay, this your vagina, right? So this is all in, this is like, I can't get up and I ain't got no pants on, I ain't gonna lie. This is kind of like, okay, say if you got your hips right here, right? Your hips right here. And like, this is right up, like right, y'all know where y'all uterus is and stuff. Your legs, okay, this your vagina, right? This your vagina, right? So imagine where your legs would be. Your legs kind of start up here. And that pain sometimes can cause it to radiate down the leg or make it go numb. Yeah, this video is all over the place, but make sure y'all like, comment, and subscribe. Also, wait, let me get into a diagnostic laparoscopy. So basically, what they'll do is say, you got your stomach right here, right? All right, now y'all getting out of hand. This your stomach, and this your abdomen right here. So these are called keyhole incisions. Y'all ever seen a keyhole that you stick a key in to get in your house? Yeah, they're small. So these are called keyhole incisions because this is a minimally invasive surgery. So what they do is cut here in the abdomen, cut here in the abdomen, and one in the belly button. Now, when they do one in the belly button, that's going to be your biggest cut. So what they do is put their laparoscope, I think what it's called, in there. And that's a camera. And they blow your abdomen up with CO2, carbon dioxide, harmless gas, right? It's what you breathe out. And through that camera, they can see. And if they see any, I'll add pictures and everything. If I have any pictures from my procedure, I'll share. If they see any spots or anything, they go ahead and, like, you know, remove it. If it's in a risky spot where you could die or you can get risk of sepsis, they won't touch it. And I get that, right? They'll see cysts. Sometimes if you watch my previous videos, I talked about this. They might see a chocolate cyst. And what a chocolate cyst is just a cyst that's filled with brown fluid. Like, it literally, like when they bust it open or whatever they do to it, it look like chocolate is pouring out. It's so cool. And yeah, them scars heal up. You know, your recovery should be like maybe 1 to 2 weeks. I'm only taking a week off, baby, because I gotta get back to pushing them weights. I gotta get back to boxing. I gotta get back out there in them streets. Like, bro, I'm already sitting down for a week. Y'all ain't take shit else from me. Like, but yeah, that's basically what it is. Now, side effects of this surgery, there's always risk. I'm terrified. I've never had surgery. Y'all probably gonna see a video in here of me crying or something, but because I've been crying like weeks ago and this week because I'm scared. I'm having anesthesia. I just ain't trying to tell all my business and stuff, but the doctor said that's laughing gas. So my deep dark secrets will stay to myself because your girl been doing some things she ain't had no business doing, baby. And I ain't trying to get off that anesthesia and be talking crazy. But she said I'm not getting no laughing gas, so the anesthesia will be fine, right? Another risk that I ran, I am a hypertensive patient. I do take hypertensive medications. And there's always a risk of, you know, your blood pressure dropping too high or too low. But she said I'm very low risk. And although I think I'm considered a bariatric patient also because my BMI is way too high. And that's why I'm working out and taking steps to better myself and my, you know, get my fitness journey going. So you always run a risk when your BMI is high. That's why I like when women get BBLs and stuff, they won't take you if you're too big. They won't take you if you're too small. You got to be minimal size. Not minimal size, optimal size. And yeah, that's just kind of like, it is not February, baby. Why? That nigga trying to show up and show out the shit. Just because I use y'all little brother don't mean y'all got to come in the picture and shit. Girl, you was talking to balloons. I wonder if that's a side effect of, yeah, you can't lose your mind with that shit. Trust me. But yeah, I love y'all so much. Make sure y'all like, comment, and subscribe. Tell me if y'all want to see more content on like diseases and stuff. Oh my gosh, that was so fun actually. I'm glad I got up and did this shit. Cause Ben was supposed to do this. Ben get in motion. Ben getting money. Ben on the whole net. Yeah, nigga. But now I love y'all. Bye.